Welcome to Health Diary. My name is Winnie Lubembe and we're coming to you from 4 Points by Sheraton right here in Hurlingham. Now, during pregnancy, different changes occur in a woman's body that sometimes might expose them to various conditions, preeclampsia being one of them. But we have another condition that develops during pregnancy that is not as common, and that is the Hellp syndrome. So what exactly is it? Who is more at risk of developing Hellp syndrome? And what are the treatment options for the same? Well, we find out after this fact of the matter. Hellp, or hemolysis elevated liver enzymes and low platelets syndrome, is a life-threatening pregnancy complication usually considered to be a variant of preeclampsia. Hellp syndrome can be difficult to diagnose because of all the typical signs of preeclampsia which may not be apparent, such as high blood pressure and protein in the urine. Therefore, early diagnosis is critical because serious illness and even death can occur in about 25% of cases.
Fanis Otiende. I'm a mother of 3 and preeclampsia survivor and Hellp syndrome survivor. I got postpartum preeclampsia twice after the birth of my first 2 babies. And then when I got pregnant with my 3rd baby, I was still hypertensive, so I was still taking medication. My blood pressure had not stabilized. So when I conceived during my 3rd trimester, that's when things got out of hand. I was at work, I started feeling my chest so puffed up until I had to go to the washroom and try to loosen my bra, and then I started feeling dizzy, very tired, so I decided to go home. That evening at around 6 p.m. I started vomiting, and then the 3rd time I decided to call my gynae. When I called him, he asked about my blood pressure, how it was. I checked my blood pressure, it was slightly elevated, and then he told me to either go to the hospital or check the blood pressure after 3 hours, and then if it's gone down, then I should just see him the following day in his clinic. So when the results came out, my liver enzymes had gone up, they were elevated. On Sunday when I saw my gynae, my HB levels were 14, and then on that particular Wednesday it was around 9, so it dropped. My platelets level had dropped. On that Wednesday they were around 89. The normal ranges are between 150 to 450 for a normal adult. The main thing is to monitor your blood pressure, especially if you've had a previous experience with the hypertension during pregnancy. Most people don't normally ask questions. You go to the hospital, you're told, your blood pressure is 150. Go to the pharmacy, get these meds. But you don't really ask about the risks associated with that, what to expect, and what might happen to you if you don't adhere to those drugs, the medications. So it's always good as a woman, if you're pregnant, ask questions. Don't take anything lightly, any symptom. There's no known cause for Hellp syndrome, but there are predisposing factors. Like if you have preeclampsia, they know there are those risks that are associated with somebody who has preeclampsia. So one of the risks is getting that Hellp syndrome, but it's not documented that there's a specific cause for Hellp syndrome, no. But we're just told that now that you have preeclampsia, you need to be careful, you need to work on this blood pressure, ensure that you don't get any adverse effects, which I think maybe the studies need to be done on that so that at least you know what you're dealing with.
Hellp syndrome. What exactly is it about, and who is at risk of the same? Well, let's get to understand more on the same. And of course, to help us with the conversation, I am joined by Dr. Angela Anzeze, who is a gynecologist at Mirazi Healthcare and AAR Clinics. Doctor, it's so good to see you once again.
Thank you very much. Thank you. Nice to see you again.
Karibu sana to the show. And we also have Lucy Frederick, who is a Hellp champion. And I know most of you are thinking, Hellp, what is that all about? You'll find out in a minute. But Lucy, it's so good to meet you. Karibu sana to the show, and thank you really for coming by to share your story with us. So Dr. Angela, let's just start with you. Yes. Just the term Hellp in itself. I'm sure someone is watching and thinking, what are you talking about? What exactly is it?
Hellp syndrome stands for hemolysis, elevated liver enzymes, and low platelet count. So it's a condition that occurs commonly in pregnancy, and it can occur as an isolated cause or as as an isolated cause in pregnancy or in association with preeclampsia. So preeclampsia is a complication of pregnancy that occurs when you have very high blood pressures diagnosed after 20 weeks of pregnancy. So when you have very high blood pressures, it can be very severe in pregnancy and lead to Hellp syndrome.
Lucy, so for you, it's not a condition that we hear on a daily basis, you know, but you had it, right? Yes. The question is, what exactly happened? Just take us through your pregnancy.
I was excited, of course, to find out that I was expecting. Yes. So there are things that you know happen in pregnancy, you know, the nausea, vomiting, and all those things, the mood swings. But after my 20th week, my blood pressure started going up a bit. Not that it was borderline high, yeah, but it was of a concern. But because I had already done the test, the blood test and all those things, and they had ruled out everything that could have been wrong, I continued with the journey. But the issue was, on my 20th week, I was still having the nausea, vomit. I was losing weight at some point. And then towards now the 25th week, things now started getting haywire. The pressure was still a bit high, but when they were doing the test to rule out preeclampsia, they couldn't find protein in the urine. So on the 28th week, now I started gaining weight, like sudden weight gain, from 65 to about 80. Wow. Because by the time I was getting my baby, I was 83 kgs from 65 in a week.
In a week?
In a week, yes. So the other thing that I noticed was the swelling, my face, my hands, dizziness. I'd get very tired, you know, the shortness in breathing. I think at one point, a doctor commented and said, if you continue this way, you might get your child at 32 weeks, because I suspect you're a high-risk patient. You might get preeclampsia, but at that point, they had not confirmed.
So all this while, and the symptoms that you're presenting, they're more or less, you know, number one, just like the normal things that happen in pregnancy,
like
nausea,
if I would ask people, they would say it's normal. It's
normal.
What we call normal.
Yes.
But what I've come to learn is that instinctively, you feel your body is trying to tell you something. So I knew something was wrong, but we have to confirm some of those things. Yeah. So by the time the 29th week came, I went to hospital and did all those tests, even the blood work, and then nothing was changing. By then I had an epigastric pain, and it felt very tender. So I went, did those tests, then the doctor confirmed that I might have gastritis. So I was treated for gastritis, because the labs are still showing no protein. No protein. So I'm just thinking later on is when I started reading about the Hellp syndrome, is when I noticed all those symptoms I was exhibiting at that point were of Hellp.
Yes. I mean, Lucy kept mentioning protein in the urine, right? How important is this, especially when just trying to understand what exactly, you know, the person might be going through?
So normally when mothers come for antenatal clinics, we check their urine, and that's when it indicates there's protein. So severe levels of protein in the urine, that's like 3+, that indicates that something is going on, and it's an indicator of severe preeclampsia or Hellp syndrome. So when we focus on Hellp syndrome on its own, when it's associated with preeclampsia, so hemolysis, it means like your red blood cells are breaking down in your body, and that can present with anemia. So if your platelets are low, it means you're not coagulating properly and you're bleeding a lot. First sign of Hellp syndrome would be the low platelets and symptoms of bleeding.
Now, do we know then what causes it?
Isolated cases of Hellp, there are unknown causes, mostly genetic causes on the mother and the fetus that cause production of substances that lead to Hellp syndrome symptoms. But most commonly in our setup here, it's usually mothers with preeclampsia who have severe preeclampsia.
And Lucy, for you, was this your first baby?
That was my first. The first time I came across the name preeclampsia was I had an app on my phone for tracking the pregnancy. And I remember on the 20th week, they said if you have swelling in your hands, legs, but it crossed my mind but I didn't think much into it because, I mean, you don't wish to be sick, so you're always thinking, oh, maybe this is still normal. But by the time I was 28 weeks, I looked like I was 40 weeks pregnant. Yeah.
Okay, and so 20 week, that is the mark for preeclampsia, right? Yeah. So is that the same case for Hellp syndrome, especially an isolated case?
For Hellp syndrome, it's usually from 28 to 37 weeks.
Okay. So for you, Lucy, again, the doctor telling you this is it, you have Hellp, right? Yeah. Hellp syndrome. What was the first emotion, maybe thoughts that came to your mind?
The first thing that I thought about was, I'm 29 weeks, as in, I have like...
You have some weeks to go.
I was not prepared. I had not even started shopping for anything. So of course, instinctively, the first thing I thought was, this baby is coming. How will she be? Will she survive? So at that point is when now I was told about what happens next. Because as she said, my platelets were low. So also we also had to prepare to have people who donate blood, because there was a possibility that I would have needed an infusion. So after they gave me medication, and because what was disturbing me the most was the pain. Yeah. So of course in a hospital setting they took care of the pain. Then I was telling them I'm ready to go. Yeah. I need more time. I'm not ready. Yeah. So they organized, and I had to, again, like as she said, it's a special case. There were not so many of them, so even the specialists came, and they're the ones that told me what was going to happen. Yeah. At that point, they had already given me medication, magnesium sulfate, to prevent seizures, because I was already exhibiting all the symptoms of Hellp, except for pulmonary edema. Yeah. So that was what they were worried about. They're telling me, you only have two things. Yeah. You choose life or death.
So can we talk about how Hellp in itself affects, for example, the growth of the fetus, or development rather of the fetus?
So Hellp on its own does not directly affect the baby, but it causes the baby to be born before its time. So preterm delivery. Term is at its time, preterm is before its time. So a baby born before its time, so of course they're not ready to go through normal physiological processes at that time. So it can have long-term effects or short-term effects. Yeah.
On the baby.
Yeah.
All right, let's take a break. But of course, when we come back, the conversation on Hellp syndrome comes up after the short break. Stay with us. All right, welcome back. Glad you're still with us. The show is Health Diary, and today it's all about Hellp syndrome. And of course, to help us with the conversation, we have Dr. Angela Anzeze, who is a gynecologist at Mirazi Healthcare and AAR Clinics, as well as Lucy Frederick, who is a Hellp champion. Ladies, thank you for coming by today. Then the question as far as diagnosis is concerned. Wait, even before we talk about diagnosis, Lucy, very quickly, so what are some of the things that you had to prepare just to make sure that you boost your platelet count before you go through surgery?
Okay, other than the medication, they also gave me medication to assist with the development of the baby's lungs. So the 2 days actually, because I think it's done after 24 hours, 48 hours, sorry, yeah. Mm-hmm. And the one thing that I would only have done was now be positive and, put my trust in the doctors and just know that God is in control. So at that point, I just decided, I'll do what I can. So took a lot of water, ate well, and fortunately for me, I say fortunately for me because everything went well. During the delivery, the only thing that happened was the baby was born with a respiratory distress. So I was not able to see her at that point, and she was rushed to NICU for them to be able to take care of them. But the one thing that happened during the CS, I remember feeling each and every bit of it. That's how intense it was. And I remember they had even to add more morphine because I kept feeling the tugging. And they had to do a special CS, a T, because the baby position was, of course.
Yes, at that time, it wasn't as it's supposed to because it's not time.
So there's nothing much you can do to prepare. It's just that the option is just to deliver the baby so that you're okay.
You're okay, yes. So Dr. Angela, as far as then the diagnosis of the same, what does the process entail, and what is it that the healthcare providers should be on the lookout for?
Okay, so it starts when you see them the first time. Are they in danger? First, ensure that they're resuscitated and they're safe at that point. Once they're stable, you carry out investigations. If it's associated with preeclampsia, you need to do, of course, the blood tests, and the blood test will detect Hellp syndrome as well. So there'll be low platelets, the liver enzymes will be elevated, and the blood pressure will also be high. And most importantly is do an obstetric ultrasound at that point to check if the baby's condition at that point is safe or compromised.
So after diagnosis, what is the initial thing that is supposed to be done immediately you have a conclusive diagnosis?
So if there's preeclampsia and the blood pressures are elevated, you need to ensure that she's stable, bring down the blood pressures, as you're also giving steroids for the baby's lungs to mature, because at this point you're planning to deliver the baby earlier, preterm. So you need to prepare for a preterm delivery at that point. And if the platelets are very low and she's having bleeding associated with those low platelets, you need to transfuse, give platelets or blood transfusion, because they can also have anemia because of the excessive bleeding. And at this point, you need to involve a hematologist. So preeclampsia and Hellp syndrome is a multidisciplinary.
Yeah, you can just handle it.
Yeah, you can. Yeah. Okay. So you need to have a hematologist on board and a cardiologist as well.
Okay. All right, and Lucy, for you, after the surgery, how long did it take for you to just be completely okay to a point that you're allowed to go see the baby?
It was a scary moment. After I saw my child, somehow the pain went away, because you couldn't tell. After the second day, you couldn't tell that I had a CS. I think the adrenaline just kicked in, because now we're in a fight to look for milk, because I was not ready. So I didn't have breast milk for the first about 3 or 4 days. And then, of course, the nurses are telling you to sign off that they can feed the child with formula. So there's that issue where you're thinking, is it a bad thing?
Yes.
Is it a bad thing to give the baby formula? Does it mean my child is not going to survive because I don't have milk? So because of that stress, I think,
yeah. Where did you find then the strength?
I remember when I went down to see, because I was on, I think, 2nd floor. And of course, you're in a maternity wing where mommies are breastfeeding their children. You can hear children crying. You couldn't hear she was crying, but you couldn't hear the voice, because she's in an incubator, so tiny. You can tell she's crying. So the first thing that I did was break down. And I remember there was a doctor there, a neonatologist, who came to speak to me and, give me hope. She told me, your child is alive. We are out of the woods for now. The machines are helping her breathe, and we are taking care of her 24 hours. So she told me, your body was fighting to protect your child. And when you touch your child, the emotions, because you had a connection, she'll still feel those emotions. So she told me, the one thing I want to ask you to do is be positive and pass the same energy to your child. I keep saying it was positivity and faith in God, just knowing that I'm going to get through it. And after that, everything I prayed for, yes, we got jaundice there. She had problem with apnea, so they had to give, it was more of a caffeine to just keep the baby moving.
So very quickly, in terms of the treatment for Hellp syndrome, and then, of course, there's usually that fear of a recurrence, right? So very quickly, through the treatment process, what does that look like? And then, of course, we'll talk about complications. Are there possible complications?
Yes, there are possible complications. Yeah. So I'll start with recurrence. Yes, there's a high-risk chance of recurrence. So in mothers who have had preeclampsia with Hellp syndrome before, when we see them in the subsequent, like in the next pregnancy, we advise that we put them on calcium and aspirin from the 2nd trimester, and that prevents complications of preeclampsia, which includes Hellp. So that would reduce the risk of reoccurrence of Hellp syndrome in subsequent pregnancies. As far as complications are concerned, the complications in the mother, and the complications in the baby. So in the mother, there are a number of complications because it causes multiple organ damage in the end. It causes kidney problems because these mothers are at risk of bleeding during delivery or even thereafter, because remember they have low platelets. Yeah. And when you bleed a lot, you're reducing like the number of platelets in the, so it actually worsens, and all this can lead to multiple organ damage. Yeah. The kidneys, the liver, even the brain. You can also get a stroke as a result from bleeding or reduced blood supply. As far as the baby is concerned, remember the baby and the mother is one unit. The baby receives nutrients and oxygen from the mother. So if you have severe preeclampsia with Hellp syndrome, the blood supply to the baby is affected, so they're not getting enough oxygen. So while the mother is pregnant, the baby can get growth restriction. Because of that poor blood supply, it can affect like their normal well-being, and that's how you end up having preterm delivery.
Okay.
Yeah.
So as we bring this then to a close, and Lucy, I'm glad that you, of course, you came out okay, and the baby is okay as well, which is a good thing to hear. So what would you tell, especially probably mothers watching us and thinking?
So the first thing I say, especially for women over 35. It's good to be prepared first before you even get pregnant, yes. And also I'll talk to health workers, because the nurses kept touching on my blood pressure. Yeah, it's important that I even put things in the antenatal care to show symptoms of preeclampsia, so that some of those things can be picked early and we're able to prevent some of this. Because if it's taken care of before with medication, you're able to push up to about 34 weeks. Yeah, instead of reacting when it has already happened.
Yes.
Yeah.
All right. And very quickly on the cost issue, and what would be your call to action?
So for me, it's just to talk to our government also to come into maternal issues so that we're able to save lives. Because I don't think, in all honesty, if I wasn't in a hospital that had all those facilities, my outcome would have been the way it was.
All right. And Dr. Angela, like very, very quickly, in terms of what then should people know as far as just pregnancy, preeclampsia, and Hellp syndrome? Very quickly.
So, of course, as soon as you conceive, you start your antenatal clinics as soon as possible. And during pregnancy, take the supplements that we've mentioned, calcium and aspirin, from the second trimester. That's for aspirin. And also because preeclampsia occurs with the gestational diabetes sometimes, so you need to get screened for gestational diabetes.
All right, so Dr. Angela, very quickly, in terms of then your call to action, what is that one thing that then you'd want healthcare providers out there to have or to know, really?
So the danger signs to look out for, which I always tell my patients, even at Kenyatta Hospital where I see them as well, bleeding, reduced movements, because remember the baby's condition can be compromised at that point. So if they develop any form of reduced movements, report to hospital immediately. Severe headaches, blood vision. Epigastric pain is something that's normally overlooked in pregnancy, but that's a danger sign.
Yeah.
Excessive weight gain that you're not comfortable with.
Okay, just be cautious, really. You'd rather be cautious than not cautious, and then something happens. Dr. Angela Nzeze, gynecologist, Mirazi Healthcare and AAR Clinics, as well as Lucy Frederick, who is a Hellp champion. Ladies, thank you. Thank you very much. It has been such an insightful conversation today, and I hope that you've learned a lot from today's conversation as well. So, time now for you to take a look at this health tip.
The moment you strengthen the body, your mind definitely will get stronger. If you're able to hold a position for longer today than you did yesterday, definitely, mostly it's not the physical limitations we have, it's what we tell ourselves in our mind. Yeah, so yoga helps you come out from, the limiting thoughts, I can't do this, I'm not too flexible, yoga is not for me, yeah? And once you get on your mat and practice yoga, we modify the practice for you definitely.
Well, from today's conversation, we've learned that you'd rather be told that you're too cautious than not being cautious at all. And this is as far as pregnancy is concerned. So if you have any suspicion as far as anything that is not sitting well with you, then make sure that you head to your nearest health facility and get checked. Well, that marks the end of today's conversation on Hellp syndrome. But if you have any more questions, feel free to interact with us on our social media platforms. My name is Winnie Lubembe. A special thanks to 4 Points by Sheraton for hosting us. Until next time, adios.